Good morning, everyone. Welcome to the panelists. I'm Dr. Kenfack, the Director of Program of ofthe. And for this session of webinar, ofthe, the African Water Association, is organizing the third session of this webinar for the month of May that we agree as the global situation of pandemic coronavirus is directing us. We have to adapt our ways of communication, how better to ensure our mandate. For your information, ofthe is a 40 years old organization that put together African water utility operators to for knowledge sharing, as I said, best practice in order to improve performance of service delivery. And we operate in about 40 countries or 45 countries in Africa. And as the world pandemic is directing us to do, delivering our knowledge sharing practice through webinar is one of the models we adopt. And for this test session, which is, we will be talking on how better the water quality operators are struggling by this time to deliver their service so that population can access water of good quality. With this, we invited Mr. Govender Pratt from Run Water in South Africa, who is the Chief Manager, Analytical Service. We invite Mrs. Macauley Margaret, the Chief Manager, Water Quality at Ghana Water Company Limited. Dr. Nabusuga Irene, who is the Manager in charge of water quality at Okobi, Lola, the head of Department Water Quality at Federal Capital Territory Water Board in Abuja, Nigeria. So I will direct to the four of you the questions, basically 4 questions, and at the end you will have the opportunity to say a word for conclusion. Out of that, the participants which are following us will be having the opportunity to type question by writing, and Mrs. Fatoumata Diaw, the Directors of Membership Service at ofthe, will be coordinating this aspect of our session. And to conclude, at the end, once we will have responded to all the questions, the participant will be given the floor to assess the session in 1 or 3 questions just at the end of the session. So with this, let me give the floor to Mr. Govender, first to present himself, and then he will later have the opportunity to answer to the first question of our to the first stage of our question, which will concern how does the government of South Africa facing the pandemic. What are the measures the government take and how does measure impact on the service delivery on water quality in terms of inventory of the management, sampling, team management, so that at the end you can be sure that you are delivering water of good quality to the groundwater. I think it's the Gauteng region in South Africa, water of good quality. So, Mr. Govender, you have the floor.
Thank you, Chair, and thank you for the opportunity. As the Chair has indicated, I'm from Rand Water in South Africa. I oversee the laboratory operations for Rand Water in South Africa. Rand Water supplies approximately 15 million people in the economic heartland of the country. In answering the first question with regard to government interventions in South Africa, the government of South Africa has set up 5 different alert levels in terms of lockdown requirements within the country. We were on lockdown level 5, which is the most stringent level, for about a month and a half. And about 2 weeks ago, we've entered into lockdown level 4, which is essentially observing extreme precautions to limit community transmission and outbreaks while allowing very limited activity in the country. And basically that's calling for citizens to wear mandatory cloth masks. Before I step out of my office, I've got to do this. Similarly, I've got to do the same thing when I leave home in the morning. The screening taking place before you enter a public place in South Africa or even the workplace at the entrance of our laboratories. We've got healthcare professionals that are taking temperatures of the employees who are coming into work and ask questions with regard to their health. There's also the hygiene and social distancing requirements that has been put in place as part of the regulation. And in South Africa, under lockdown level 4, there is a curfew from 8 p.m. to, from 8 p.m. to 5 a.m. With regard to the question on samples and laboratory management, samples continue to be taken. There's a very slight reduction in terms of the sampling program that supports the water quality assurance program in South Africa. So we continue by and large with the majority of the sampling. There's been no compromise there. The laboratory operations continue. We have a 6,000 meter square facility with about 100 employees. 70% of them are basically technical people walking around in white coats. And in order to continue with laboratory operations during the lockdown period, we have divided the staff into 2 groups. 50% of the staff come in at 6 a.m. and they work until about 12 noon. The next group comes in around 12:30 and they work until about 7 p.m., ensuring that all of the samples that require testing are tested so we can continue with the water quality assurance program. Thank you, Chair. I tried to make that as brief and succinct as possible. Thank you.
Thank you, Mr. Govender. And for now, the floor is given to Mrs. Macauley from Ghana. Margaret, you have the floor.
Thank you, Mr. Chairman. In Ghana, my name is Margaret Macauley. Sorry, I'm responsible for the director responsible for water quality management in Ghana Water. We have a national presence. We are the only urban utility that provides potable water to all the urban communities in the country. With us, with respect to the pandemic, after the discussion, the global discussions that began on this pandemic, the government of Ghana started educating the population on hand washing at all, encouraging people to do hand washing at all levels, and also the social distancing, as well as the wearing of the masks anywhere you are going. And also the use of the temperature. Beginning, the government instituted a partial lockdown at 2 of our largest cities, including the capital city. And also, as part of the partial lockdown measures, there was a list that the government came out with, which identified categories of institutions that were considered to be essential workers. And this included the water utility. And what that meant was that all our protocols, all our activities in terms of the treatment and distribution of potable water had to continue. The government also came up with an announcement on free water delivery to all consumers. It was to last for 3 months from April to June, but the announcement was made in March. So immediately it triggered reactions from the public demanding for water everywhere. So what we did as a utility was to come up with strategies to ensure that communities that were underserved would receive potable water. And what we did was to come up with poly tanks and to identify these areas and the communities where poly tanks would be installed. And we also engaged private tanker operators who would assist us in commuting and drawing the water from our hydrants and taking them to the poly tanks. So these are some of the measures that we took. And also as an institution, we also came up with a decongestion effort for our staff. So immediately, national service persons, those on attachment, pregnant women and other categories of staff were asked to take their annual leave with immediate effect in order for us to respond to the social distancing protocols, even in our offices. Now, in all our regions, we also, since all our staff were expected to be at post, we sent out a communique to address the issue of the COVID-19 and how it impacts on water supply. And the main message was that the virus is able to be inactivated by the use of a disinfectant such as the chlorine that we use, the chlorine gas that we use. And so all treatment activities were to continue. We were supposed to ensure the effective implementation of our treatment protocols, all the activities that we do, and to ensure that we do adequate disinfection. Following this protocol, we also ensure that all the regions, we already have some level of autonomy of the regions, in the sense that we have adequate staff, we have adequate resources for each region to work independently. Also another logistics, and we ensured that the treatment chemicals were transported from our, we have a central store. So we ensured that all logistics and treatment chemicals were transported so that the regions would have at least 3 months stock levels of all the logistics that are needed. With regard to the reorganization of the staff, one of the things that we also did was that we ensured that staff would not move across towns and cities. And this was why it was necessary for us to do a restocking of all the things that we use frequently. In order to maintain treatment processes, sampling and laboratory management, what we did was to maintain process control at all the treatment plants. process control was supposed to be maintained, and also the frequency of sampling, especially in the consumer interface. And also the polytanks and the tankers that we were using, we put in protocols to ensure that they are disinfected properly, and those tankers and polytanks were also included in our sampling points, and the hydrants as well. Then with the team management, what we did, just as South Africa did, we divided our staff into 2 groups, and to ensure that there's rotation of staff, and also that was to respond to the social distancing, because some of the staff still needed to use public transport to get to work. So this is what we did. And we even started producing hand sanitizers in some of our labs, because in the beginning of the process, there was a serious shortage of hand sanitizers. So some of our labs produced these hand sanitizers for staff to use. And we also did a lot of virtual meetings where discussions, decisions, communication, staff communication, internal communication, Zoom meetings were held in order for decisions to be disseminated. Mr. Chairman, I think in a nutshell, this is what we did in Ghana. Thank you.
Thank you, Ms. Macauley. And we realize you follow the government rules, general rules on the pandemic, and with this we can ensure that we can be sure that Ghana Water is performing in the continuity of service. With this, we hand over the stage to Dr. Irene from Uganda. Dr. Irene, you have the floor.
Thank you, Dr. Siméon, and thank you for all that are listening in. I'm called Irene Nansubuga, and I'm the Senior Manager in charge of the Water Quality Management Department. I head it. And maybe to give a brief of National Water, it's a utility, it's a government utility, and it's at the moment it's serving about 257 towns in Uganda. And the Department of Water Quality is under the Business and Scientific Services Directorate. It has about 130 staff, and we have over 70 labs, and these are around, just like Ghana. We offer services to the whole of the country. So we are in charge of ensuring that we provide safe water and to all our customers. The water has to comply to the standards, and also the wastewater we treat has to meet the compliance standards that are given. Maybe to go about the directives after the COVID-19, the government has instituted a number of directives. Actually, the President of Uganda, His Excellency Yoweri Kaguta Museveni, has given a number of directives, and these include, I think they are similar to many that I talked about. We have a lockdown, and in this lockdown, only essential staff are allowed to move. Private vehicles and actually public vehicles are not allowed to move. We have curfews. The borders are locked. And then, so with that, we had to work within that. So the Water Quality Services Management as a whole works within an approach of water safety. An approach is planned, implemented, and monitored using the water safety plan approach. This is the one that ensures you have safety of water from the source to the treatment, to supply, and up to the consumer point. So because of that, we also work with other departments to ensure that we have this. So during this time of COVID-19, we had to come together as the different stakeholders to come up with a business continuity plan, which ensures, first of all, safety for our staff, because they have to work in an environment which is quite risky, but also to ensure that our business as National Water continues to provide safe water for the people. So we had to identify all the risks that are in place and try to mitigate them. For example, when it came to water treatment, we had to ensure that all our processes keep operating, and we have to ensure that they don't pose any risk to our customers in terms of the COVID-19. And we had to ensure that we have enough chemicals. So we had to engage our suppliers, make sure we reduce their debt period. For example, if they've supplied and haven't been paid, the debt age was reduced, and to make sure that they provided enough stock. We made enough initiation of chemicals to have them stocked to serve us for at least 8 months ahead, because we don't know how long this period would last. We also instituted a multidisciplinary team, and in this team, actually, we look at a number of issues. The team is multidisciplinary, like I said, because we have to engage other stakeholders. And this team is high level because it's headed by a director, the Director of Business and Scientific Services. It consists of other teams like the inventory, we put together the procurement team, and these finance, risk management, water quality management. All these departments have to work together. We have a team, and we sit on a weekly basis. This team actually was there before the COVID-19, but because of COVID-19 period, we had to even intensify. So we meet on a weekly basis. We discuss the supplies of chemicals, what is coming in, to make sure that we have enough stock. We look at the consumption. We regulate what has to be used to ensure that at the end of it all, we can be able to treat our water during this period of COVID-19. And in that, like I said, we have worked with the suppliers to ensure that we have enough chemicals provided. We've also reviewed our chemical usage. Usually, we have to minimize to ensure that what we use is what we need to use, so that we don't waste any during this time of COVID-19. We have enough to stay us longer. We have also fast-tracked any in-house, some of the in-house innovations. For example, we've had to install electrolyzers in some areas, because this means we can use salt instead of HTH, which we get from far away, and yet we can get salt within our region. So this also has helped to make sure we sustain the stocks of what we have in case it runs out. We've looked at also other risks. For example, what if we can no longer come up to work? Like I said, we're at a national lockdown, and which has banned movement of private vehicles and public vehicles. It means we had to actually plan for our staff, make sure those with some vehicles can be accredited by the government to travel during this time, and those we can't, we plan and manage to shift in a way, plan for their movement with the office vehicles that we have in shifts. We've also divided them in shifts because we can't have everyone. Amongst the directives was to keep a 2 meter, 4 meter distance apart, social distancing from each other. And that means in the offices or in the labs where we have so many people, we've had to divide and introduce shift working to be able to reduce on the number of people. So where we had 20 people coming at the same time, we have half the number, and we now have half of them coming in this week and the other half coming in the next week. And where we can't separate that, for example, in other areas where you have only one staff, because there are areas which have only one staff to work there, they have to continue working, and we make sure they work okay. So in the field, the staff are provided with protective wear. They have masks, they have gloves, they have gumboots, and they have everything they need to protect themselves. And they're encouraged to keep a safe distance. They're encouraged to keep a safe distance from each other. Also, the equipment they take to the field, they're encouraged to disinfect as they bring in. Even within the vehicles they're traveling in, we encourage them to at least not more than 3 people, as per the directive from the government. Also in the lab, we have labs that, one of our labs, the Central Reference Lab, which also offers supervision to other labs. used to receive external client samples. So we had to reduce on that and concentrate on the core business of National Water, that is looking at the samples within National Water. And so we reduced the number, first of all, to handle those samples, but also to make sure that the chemicals, the lab chemicals we had, which we had procured in an emergency way to ensure that we have for at least 8 months, to make sure that these chemicals can sustain us for 8 months, because we don't know when the COVID-19 period would end. Thank you.
Thank you, Dr. Rose. And I noted particularly that last part of your speech, which concerned the stock for emergency that you make, so that as long as what we don't expect, it should be up to 8 months, but if it goes up to that, you will be able to deliver potable water to your population. So with this, I hand over to Mrs. Lola from Abuja. Over to you, Ms. Lola.
Okay. Good afternoon.
Good afternoon.
It's nice having everybody on board. I am Mrs. Lola Okobi from FCT Water Board, Nigeria. FCT Water Board is solely responsible for supply of water, drinkable water all over the territory, inclusive of the city and the other satellite towns within and around. So over the period, we've actually been doing this, and under the supervision of FCT Minister, with my general manager, quality control, and every other one that is involved in day-to-day running of the activity of achieving purpose of giving quality water to the Federal Capital Territory. Prior COVID-19, again and again, we are sure of our catchment areas from the intake to the consumer tap. So what now has happened during the COVID-19, it came all of a sudden, but we were able to rise up to the challenge following the government principle and guidelines to actually make the pandemic not really affecting the whole people all at once. So with the sanitizer and the likes, FCT Water Board was able to get that urgently because of the Federal Capital Territory, the administration that actually was proactive in getting this done. They were able to make emergency purchases of all these things, which is inclusive of our chemicals and reagents. As Dr. Irina said, she was talking about 8 months. Our own chemical and reagents should be able to last us for 1 year, because even right away, more chemicals are being supplied under the emergency purchase because of this COVID-19. Now, with respect to monitoring, we have not been able to go from place to place, but the common point is under control, because we, like in FCT, we have one dam that has actually supplied the drinking water, and the treatment plants, about 4 of them, are located in just a particular place, so we can walk through those who have visited us before, we understand what I have said. We have quality control laboratories, and they are working even night and day to ensure the quality of the water is sustained through this pandemic. And the city laboratory also is available for those who have emerging challenges, like some people that use not our source water. We are able to attend to them, maybe about 2 or 3 in this little time, had come making requests for their water to be checked. And we were able to assist them to ensure the water they are drinking is good. And people also all come to the dam area to fetch water. What the management actually have done was to provide a point for them outside so that they don't get us in the dam affected one. Then we did not allow people to come into the strangers or visitors to come into the dam again. It has been stopped. So there is no visiting to the dam of FCT Water Board by anybody that is not authorized. And everything within the catchment is continuously being monitored. We actually have Civil Defense of Nigeria with us monitoring the dam so that we do not have any problem of any sort with the COVID-19, the pandemic in question, affecting us generally now in Nigeria. And here and again, people make announcements of any pipe burst. We have our adequate distribution departments that are up to the task, with all the area managers up and doing at every point in this pandemic. When there is a pipe burst, it is immediately maintained so that we do not allow a recontamination of the drinking water line for the people of the city. So with all the things that have been adequately put in place, we pray that the pandemic will come to an end. Our shutdown has been eased. But even when it was total shutdown in the city of Abuja, we are graded as essential services, and we actually have pass. Each individual that is involved in the day-to-day activity of the organization has pass to move within and around the city to attend to his or her business as it affects the whole federal capital city. I think with that, I can take a break.
Thank you, Ms. Lola. It's just a break because the next question, which will be short for all of you, is that we knew that the government, in one of the most important barriers is hand washing, and hand washing require water and potable water. I want each of you in only 1 minute to say something about the water consumption. Has this increased? Are you facing a specific challenge in the water resource? Thank you, and we start with Govinda. Is Govinda online? Otherwise, we move to Margaret, expecting Govinda will join.
Okay, thank you very much, Mr. Chairman. With respect to the demand for potable water, yes, indeed, the demand for potable water has gone up significantly. For us in Ghana, as I indicated earlier, all our activities of treatment, transmission, distribution are ongoing. what we have emphasized is the effective implementation of all our treatment procedures and protocols. And what we want to achieve is that we'll be able to detect non-conformities. So water quality monitoring is ongoing throughout the supply chain. We have also ensured that good residual chlorine levels are maintained throughout, from the treatment plant all the way to the consumer interface. And also we have a call center. We have always had this call center where they work on shifts 24 hours a day. There are 3 shifts. And so we are able to capture consumer complaints, and these complaints are channeled to the appropriate quarters for redress. The challenges that we have had during this time is following from the social distancing restrictions, where we had to come up with staff rotations. So it means that even though we are working, nothing has changed with our working protocols. We have fewer people. I'm talking about the laboratories. We have fewer staff.
Can I recenter the question on the water consumption? Has the volume you need to supply the population, has this increased? And are you enough resource, water resource, to supply your population?
Okay, thank you, Mr. Chairman. Can you hear me?
Yeah.
Yes, Mr. Chairman, I indicated that the demand has gone up.
Okay.
But we have not increased our production. The production has not increased. No. So it means that we have to ration the water that is available. I indicated earlier that some underserved communities are now being served as a result of the government instruction to make sure that everybody gets water. So now we are sharing. Yes, we are sharing.
Thank you.
Yes, thank you very much.
So the solution in Ghana to face the demand is to ration water,
to ration the
so
water.
That you make sure that everyone has at least a minimum for hand washing.
Exactly.
Thank you. Dr. Irene, the case in Uganda.
Thank you, Dr. Siméon. The case in Uganda is similar. The consumption has actually increased because, the demand has increased because, like she mentioned, or maybe I should mention that it's a directive. People have to wash hands. If not wash hands, sanitize. So because washing hands is a cheaper option, many people are washing hands, they are sanitizing their areas, their desks and all that. They've heeded to the call to wash hands. So we have more water being used up by the population. But that means that in order to do that, we have to ration. So some people will get at this time and others will get at another time. Also, as National Water, we have put up some points in water-stressed areas which didn't have water. So about 40 have already been installed right now and more are being installed. So that means there's more water coming, being supplied, and therefore we have to ration to have everyone have some of this safe water. That's what we are doing.
Thank you, Dr. Irene. So rationing water as a solution to make sure by the company that at least the most part of the population has a minimum of water, specifically for hand washing. Ms. Lola, different case in Nigeria or similar? Please, your microphone. Please, your microphone. Okay, good. Your microphone. Microphone, please. Good. Good.
Okay. Thank you so much, Dr. Kenfack. We have similar experience of increase in water demand also in Nigeria, because the core business is washing of hands, which is even should be preferred more than sanitizer. So all over our own premise here, we have tankers, tanks for washing of hands, and all over our water, our dam also. So, and sanitizer are there. And you know that even across all the maybe banks and the likes that are already called service during this pandemic, all of them are making more demand on water. However, we are not actually having shortage of water within the city because of the capacity of our dam and our treatment plants, because we could actually treat up to 720,000 cubic meter of water per day, which we have not been able to exhaust prior to COVID-19. And to all the underserved areas, the government, because of this, actually purchased even water tankers to add more to the tankers we have so that they could be serviced and help. And what we've discovered, even some areas that have been have shortage of water, we've been able to increase supply to them. So all over the city and the area councils, there is no shortage of water for now. And we do hope we are able to maintain it. Why? Because we could always call for more water from the Gurara Dam that is upstream, that have about ×8 of Usuman Dam capacity. Gurara has about 800 million impounded water. And in times like this, we could call for it in case our own dam water is becoming low. But for now, there's no cause for alarm because the rainy season is setting in and the dam will be filled. So can actually meet the demand for now.
Thank you, thank you. So we can record that in your case in Abuja, this coronavirus threat promote, even if we can say, promote your business in the company because you are treating more water, meaning you are selling more water, and at the end, if all the bills are paid, you will earn more money. Thank you. And Brad?
That's the spirit, all bills.
Brad,
Thank you, Chair. Sorry.
What is
Sorry,
the case?
yeah, we lost connection for a little while there. My apologies.
Yeah.
In terms of water demand, Rand water supplies on average between 4,500 and 5,000 megaliters on a daily basis. As we entered the winter season, the demand has dropped, and we found that during the lockdown period, although the washing of hands has become quite a common habit in terms of fighting the pandemic, water demand has actually decreased.
Oh.
Generally, the demand around these times year on year is about 4,300 megaliters. We're currently been supplying 4,100 megaliters. Thank you, Chair.
Thank you. So with this, and we are approaching the end, and we know that the participants are waiting for the question, and Mrs. Fatu will be raise some question. And now, this is the third initiative of webinar with AFWA, and maybe you as member, you need more support or some support from AFWA if it's the case. So I want Irene and Miss to answer this specific question if you have any request from AFWA to improve how we can support our members in these terms, in these periods of confinement and above. Why not? Irene?
Yes, thank you, Dr. Siméon. I think, first of all, these webinars, the knowledge exchange programs, are already a very good idea, because we can look at what we are doing and also share ideas on how to handle the challenges. One of the challenges maybe I didn't mention was the fact that in Uganda we have a no disconnection policy right now. We can't disconnect people, and that means that much as the water consumption could have increased, it doesn't translate into increased income, and yet we need the money for treating, buying chemicals, repairing pumps, doing all those things. So that means there's a limit to the cash flow, and that means if we can't come up with ideas, so we can come up with, maybe as AFWA, we can find ways, we can discuss, continue with these innovative knowledge sharing platforms to help each other find ways of chipping in when it comes to how we can handle these issues, apart from what we are already doing, or maybe sensitizing and having the customers come to pay the water. I'm also thinking we can also draw up some standardized best practices that we can share for water utilities in emergency situations like these, like pandemics, so that in case these pandemics happen, we can always refer to them and be able to adopt and handle and follow. Also, we can come up with training tools, maybe video training tools on issues that are necessary to handle such crises that are happening. Thank you.
Thank you. And Margaret, any requests from AFWA side?
Yes, Mr.
For more
Chairman.
support?
Yes, I think that, thank you very much, Irene. Irene has actually mentioned some of the areas that I wanted to talk about, but I'd like to add that I think that already we have a newsletter. AFWA has a newsletter, and I think that it would be good if we can include some sort of a performance league table in the newsletter. And then also when we meet at our AFWA conferences, if this league table can be highlighted for everybody to know which countries are doing well in terms of the best practices that Irene spoke about, I think it would be a very good point. Thank you very much.
Thank you, Margaret. And talking of best practice, AFWA, be aware that AFWA is very soon to set a platform for benchmarking, and of course during the STC or the conference, we could also present such a ranking of who is doing better on what, and we note it, and Mrs. Fatoumata is the one who will be working with you on that. With this, and before I can give the stage to Madam Diaw, if she can raise one or two questions from the participant. Ms. Fatou?
Thank you, Dr. Kenfack. Greetings, welcome, and thank you for attending, to all the panelists and to all the participants. I'd like to just ask two questions that have come up that have not been answered from participants. One of the questions is that in semi-urban settlements, there are public water taps that are really collection points for the community. For those of you who work with the communities on those semi-public access spaces, how does one work on safety there, meaning water safety? And the second question is similar, actually, very much similar. The safety of water tanks. water tanks that are used to supply the communities with additional water. How do the water utilities look into the safety of that water that is manifestly distributed by private counterparts or partners? Thank you. Over.
So can Irene, Dr. Irene, please, can you answer the first question, and Mrs. Lola, the second one concerning the tanks?
So for the public standpoint, that is the public taps in the areas, we actually have a target to have as many of those in our bid to increase coverage of safe water, and we've had many of those. Maybe I forgot to mention that when we are reviewing our safety plan, in terms of water quality monitoring, we had to now focus on a few points, points. We have to focus on reservoirs, critical risk areas, the reservoirs, the public taps, the critical points. And these are some of the critical points we included: the public tanks and the public taps. So we have to ensure that as often as possible, we take the water quality of these taps and test and make sure it is serving it is safe for human consumption. So it's still on our program.
Thank you. We lost Mrs. Lola, and knowing that Ghana also used tanks for service delivery. Margaret, can you answer?
Yes, thank you very much, Mr. Chairman. I'd like to add a little to what Irene said with respect to how we ensure water quality at the community taps. One of the things we also do is that wherever we find a storage tank, we advise, we take samples from those storage tanks that serve them. And also, if we find that there's a positive growth, then we advise them on how to clean these tanks. Or we also offer our services to clean the tanks for them. And then for the second question, which has to do with how we monitor the water tankers, safety of the water tankers. Again, we take samples. In fact, I was indicating earlier on that we actually disinfect these water tankers, and we follow it up with sampling and testing. So the disinfection has to be done, and then you follow it up with sampling and testing. Thank you.
Thank you. Now we still have 4 minutes, and in 4 minutes, I will ask each of you to say in 1 minute the last word, and after that, the participant will assess the session, please. So let us follow the first protocol, starting by Brad for the last word, then Margaret, then Irene, and Lola will end. Will say the last word.
Thank you,
So,
Chair.
Yeah.
Thank you, Chair. I think from the perspective of laboratory operations, in terms of carrying out monitoring for water quality, serious thought needs to be given going forward, especially in terms of decentralizing laboratory operations by way of online and real-time monitoring. This epidemic has really taught us that you cannot rely on a group of people working at a bench should the pandemic unfortunately strike such a group of people. So we need to turn to alternative technologies to support the water quality assurance program. Thank you, Chair.
Thank you, thank you. I like that one. Online monitoring, new technology for water quality monitoring, that is very, very important for the future, especially when confinement is considered. So, Margaret?
Yes, Mr. Chairman, I also like to say that governments and management of water utilities should improve their priority for water quality testing and monitoring, the investment and the budgeting that is done for water quality, because we are playing a very, very critical role in improving public health and supporting public health interventions in all our countries. Thank you very much.
Thank you, Margaret, especially when we consider that in some utilities, the laboratory is just considered as a backyard service. The government and the utilities should take priority on budgeting for water quality. Thank you. Irene?
Thank you, Dr. Siméon. I think my probably last word would be about the fact that we need to understand that these problems would always come, and so all utilities should be able to have risk management or a risk department that can be able to look ahead, see what is coming towards us, and be able to plan ahead. And we should be able to be a little more innovative on seeing how to work. For example, adapting the e-platforms for meetings, for even accountability, data sharing, water quality management apps, like Frags mentioned. All these things would help us in such circumstances, and we should encourage more knowledge sharing. Thank you.
Thank you, thank you, thank you. I capture the word innovative. We should be innovative. We should use e-platforms. These two words are important for the future. And last but not the least, Lola, you have the speech.
Sorry, the internet went off in the course of the discussion. However, thank you for the opportunity given to us to share with the region what the water quality in Nigeria is, even from the Federal Capital Territory. All the contribution has been so valid. We look up to that. They were part of what I was supposed to have suggested. The online monitoring could not be overemphasized, and especially at the catchment area, because in today there are so many emerging pollutants that we are unable to capture. So if the online monitoring are there, I think it will be good. So AFWAC will begin to assist us to set up that in Africa. Then we in the FCT, we appreciate if we could actually have, if it is within the purview of AFWAC to support us with customized vehicle for water quality monitoring that actually could be fit with on-site equipment. Wow. So that it's going to ease. And in technological world also, it will reduce the influence of human error. For our staff, they are able to be up and doing to check the quality of monitoring, despite the fact we cannot have everyone on their body with doing all the assignments. So we thank you for the great opportunity. We wish you very, very well. God bless you.
Thank you, Lola. And before the last word for AFWA site will be given by Ms. Fatou. But before that, I would like to capture this on-site equipment that together with the online monitoring process, this could speed up the process and especially be used for during in such a situation the world is facing now, so to ensure the water quality, the water of good quality to our population. With this, thank you all to all the panelists, thank to the participants, and Ms. Fatou, you have the last word for AFWA. Thank you.
Thank you, Dr. Kenfack. I would like to thank all panelists again very much for making this a very lively and enriching exchange with the water community. We would like to also thank all the participants for attending this seminar. And we would like to invite them to continue to join ofthe for our upcoming webinars, and also ask everyone to come and join and be a member of ofthe. Thank you, and looking forward to seeing everybody again online.